I'm Dr. Jones DC, and welcome to your introductory video regarding semaglutide and tirzepatide, the key things that you need to understand and be prepared for on your new journey towards optimal health, which involves weight loss, guys. James Scott is such a dear friend of mine, and he cares as much as I do about utilizing these medications right. So he reached out to me so I can help make this video for you guys, because we both share a passion of utilizing semaglutide and tirzepatide with proper lifestyle interventions and support. And so guys, I really need you to pay attention to this video so that you can get the most out of your journey with Health Innovations KC. Number one, let's start with what are GLP-1 medications. GLP-1 medications are short for glucagon-like peptide 1. These are hormones that are referred to as incretin hormones, which are hormones in your system that respond to eating and not eating, and they're involved with various processes that govern and control when you eat, how much you're gonna eat, when you stop, all that kind of stuff. And so what scientists did, which is pretty awesome, is they tweaked them and they played with them and made them stronger. And they've gone through many, many iterations, but semaglutide, tirzepatide now are the holy grail in terms of providing us something that can actually shut down food chatter, which for most people is the reason why they can't have any level of success when they embark on their weight loss programs or if they're battling obesity. So GLP-1 medications, modified incretin hormones, and they're available for us to use for appetite suppression. How do they work in our body? So we have receptor sites for incretin hormones in various places in the body, but specifically with regards to why we're using them, in the intestines, there are receptors for GLP-1s. And so what these medications will do is actually slow down the transit of food, and that's what is going to contribute to fullness. It's going to really take its time to move that food through the digestive system and really stimulate those mechanical receptors that we have that creates that physical amount of fullness. These medications don't just stop there with regards to hunger, they actually act on the hypothalamus, which is this powerful regulatory center in the body. And these medications work to target this area and give us an aggressive effect in the reduction of hunger, cravings. Whew, my gosh, we've done it on thousands of patients myself in our clinics, and they work really well. So multiple different centers of the body so that we can get maximal appetite suppression. And then these medications also will improve insulin sensitivity. And that to me is probably the most powerful thing that they do. I don't know, they're both big deals. Reduce the appetite, make you more insulin sensitive. And by the way, making you more insulin sensitive is the same thing as saying reduction in insulin resistance, which might be the term that you've heard of more. Insulin resistance, in my opinion, is the beginning of obesity. It's the beginning of diabetes, among many other factors. Yes, obesity is a disease, and it's the hallmark, classic symptoms of obesity or just weight loss resistance if you're not obese yet, is high amounts of insulin resistance alongside inflammation and poor metabolic flexibility. So these medications are great to deal with those initial barriers, food chatter, and implement lifestyle interventions that you're going to be able to get from support from Health Innovations KC. Common side effects to expect with GLP-1 medications. Number one is nausea. About 50% of people will experience some nausea. That's just the reality of what you can expect. So just expect that you're going to get it, and if you don't, great. Nausea is something that can be very minimal to, in rare cases, very severe. As we work our way down the side effect list, you can have some diarrhea, some indigestion and bloating. That's less common, but still considered a common side effect. And then vomiting, about some amount of vomiting, throwing up in about maybe 5-10% of patients. So if you are experiencing any symptoms that seem life-threatening or seem very severe, as always, call 911. But guys, these medications are very, very safe, and the incidence of anything like that happening is extremely rare. But as always, just be aware, because that's the case with any medication. So really, all we need to worry about, the potential, is nausea, some indigestion, bloating, and potentially some vomiting. Number 4, mitigation of these symptoms. So when it comes to nausea, there are a couple little tips and tricks that you can do to deal with it. Number one, if you are experiencing nausea, respect the titration dose, which we're about to go over in a little bit. You're working with KC Health Innovations, so you're in good hands. They're gonna be working with you. They're gonna be guiding you. There's a lot of people out there that are trying to do this on their own and they're just getting wrecked. So you guys are in good hands. Respect it and do not increase the dose on your own without the proper guidance from your providers at Health Innovations. One of my favorite little tips and tricks that you can do is literally alcohol prep pads that you can get at your local pharmacies. Alcohol prep pads, you can sniff those during times of nausea, and a lot of patients have reported some immediate or some dramatic improvements in their nausea. So give that a whirl, see if that helps. The next thing you can try is looking at when the nausea is happening, because it's probably happening due to how you're eating or maybe some other triggers too as well. So try to identify the triggers. It's more likely food, and it's more likely eating too much in a single window. So as much as we're big fans of fasting, and we're gonna get into all that, and you'll have access to many resources regarding how to implement fasting, there are times where you have to spread those meals out, and you can still do that in an 8-hour eating window, so don't feel like you can't get your fasting in. Just don't eat too much in a single sitting if it's causing you some nausea side effects. And that also goes for bloating and indigestion type side effects as well. So if all of that has failed to work, then we can start getting into some actual external support. Ginger is phenomenal. Ginger's been used for Chinese medicine for thousands of years. You can get ginger from the actual ginger's root. You make some tea, you can eat it directly, although, it's spicy, so be careful. You can get ginger supplements over the counter, Amazon, ginger's everywhere. You can make ginger again into tea, or you can get ginger tea bags too as well. But give ginger a shot and see if it'll help. Beyond all of that, if we're still struggling with nausea, then we can start getting into some medications. So over the counter, you will be able to find Dramamine. So Dramamine is available over the counter, helps with nausea. Take it, see if it works. And then finally, if you're taking Dramamine and you are still dealing with nausea, my next recommendation would be getting a prescription of Zofran, which is a pharmaceutical agent, and I hate recommending drugs to handle a side effect of another drug, which is why my list was given in a specific order. But if you're at that point, it's not gonna last for a while. The nausea, by the way, guys, just over time, it's important to understand, will get better in almost all cases. If it doesn't get better, be sure to contact Health Innovations and let them know. Or if you're concerned about how bad it is, be sure to contact them and let them know. But generally speaking, it gets better over time. And these are recommendations to help you situationally if it's just too much to deal with. Okay, now indigestion and bloating. There's less options there. So again, related to the food that's moving a lot slower, digestive enzymes are a nice option to try if you are feeling like you're getting that kind of bloating feeling. And so digestive enzymes, broad spectrum, are nice. And I'm sure KC Innovations is going to provide you a link where you can purchase these various supplements that we're talking about. So broad spectrum enzymes, and then also too, pairing it with your food. Looking at your food just like you did with nausea. What are you eating before this reaction happens? And playing with it, trying to figure out exactly what works for you. Again, the same rules for healthy eating are going to apply for this. We want to reduce our processed food. We want to reduce our consumption of sugar. None of that changes, but there could be certain triggers. There could be certain types. It could be the amount. Try to figure out if you notice a pattern and let Health Innovations know if it's not getting better. Now we get to vomiting. So vomiting and diarrhea is going to produce excessive loss of water and an excessive loss of electrolytes. So just to deal with it and keep your body functioning optimally, if you are dealing with diarrhea or you are dealing with vomiting, be sure to consume additional electrolytes. Broad spectrum electrolytes that are sugar-free are going to be your best bet, especially if you're pairing it up with some fasting too as well. So be sure to stay hydrated and add electrolytes. In the category of vomiting, I like to go straight to over the counter when it comes to throwing up, because that sucks. That's a more extreme symptom and it's very debilitating. So go straight to some over the counter or possible prescriptive options to help you. Okay, so we just talked about vomiting and diarrhea being much rarer, but still can happen side effect. And so a lot of the same recommendations that we discussed with regards to nausea are going to be still important, and what you can try to look for and use for assistance if you're dealing with vomiting or excessive diarrhea. But just again, emphasis on the electrolytes. The electrolytes are going to be key so that you don't suffer with dehydration related side effects. And if the excessive diarrhea or vomiting doesn't get better, because it's a little bit more than just a nausea kind of annoying thing, be sure to reach out to Health Innovations KC for better guidance. Number 5, titration schedule with regard to semaglutide and tirzepatide. So with semaglutide, you are going to be starting off with 0.25 milligrams. This is the dose of your medication, and you will do this for 4 weeks. I know you're excited and I know you want to rush this. Do not rush this process. There's a reason why they want you to do 4 weeks, because this medication can wreck you if you go too fast. You guys are, again, good hands. Casey's going to be monitoring you and taking good care of you. And so 4 weeks, excess tolerance, and then your provider will begin to increase your dose. For many people with semaglutide, increases between 0.25 to 0.5 milligrams, with the maximum dose being 2.4, and of course your provider is going to be working with you for optimal dosing. Now tirzepatide, 2.5 milligrams is that initial dose, 4 weeks, assessing tolerance, making sure you're good, and then working your way up that dose, increments of 2.5 or maybe a 5 milligram jump. Again, your provider is going to dictate the exact plan for you and is going to let you know when you hit that optimal dose, which obviously means we're getting good weight loss and we're feeling a good reduction of our food chatter so that we can make better choices. Number 6, managing expectations. I know that you're excited, you're pumped, and you might have heard me say things like, this is the most powerful appetite suppressing medication. And I mean it when I say that, it really is. And for a lot more people now, they are finally able to tap into weight loss that were not before. But you have to understand, this does not mean it's going to apply to everybody. I personally, with my clinics, about 10 to 15% of people are not going to respond. And this means that there may be other issues going on. And so be in communication with Health Innovations, letting them know if you're not getting results, and they will do everything that they possibly can to help you and ensure that you are getting the best results. But just, you gotta chill out. You gotta take a chill pill, breathe with me, and be patient. It could take up to 6-7 weeks just to get to the clinical dose, and then another week or 2 at that dose before you begin to even potentially get frustrated. But then, even if you are in that case, there still is and can be many solutions that Health Innovations will provide and help guide you and support you in. Number 7, I want to talk about brick and mortars versus virtual clinics. Now, you guys are working with Health Innovations, which is a great establishment, and knowing James myself personally, he cares a lot. He wants to give the best information to you guys, and we both really think very similarly in terms of how we want to approach these medications. And so this clinic is going to be holding your hand, guiding you, and supporting you. But for anybody out there that you know that you're friends with, these virtual clinics, man, you got to be careful, because they're just trying to make a quick buck. These virtual clinics are there. You have a doctor appointment and they give the prescription, and then you're completely on your own. Trust me, I know it. We have a lot of social media presence, and we get these calls every single day with people that they had this one call with the provider and they're completely on their own. So this is something that, if you know anybody that is in the KC area, get them over to Health Innovations, where James can ensure that they're set up properly and that they have proper guidance and proper structure, because this is something that the literature says people will rebound with their weight gain when they stop. And what I've been able to do with James and help with his patients is provide a format where the coaching and the structure and the support that you guys are getting from his clinic is going to help you so that you are successful long term. This is one of the many benefits that you're going to expect and that you are going to get and that you can expect with Health Innovations KC. Okay, number 8. Now we're going to talk about how to administer a subcutaneous injection. Guys, don't freak out. Subcutaneous into the fat tissue. It's a tiny little needle. Check it out. Look how small this bad boy is. You can't even see it. I mean, literally, I'm trying to bring it into focus. It's a very, very easy injection. Okay, so step number 1, put this needle back into the little container. Step number 1, I had just opened this, so you're gonna open your alcohol prep pad, put the little wrapper on the bottom, you're gonna wipe the top of your bottle. You got this little bottle here. There's a rubber stopper there. Gonna disinfect that bottle every single time, good practice. You always want to draw into the needle how much. So in this case, we're gonna go for 10 units that we're gonna inject of this particular peptide. Your provider is always gonna let you know the amount of units that you're going to be injecting. So vertically tap the top of the bottle in the rubber stopper very gently. There's just the weight of the needle is pushing into it, and then I slowly push down. If you just press into the rubber stopper, you're gonna bend these needles, and so don't do that. Slow, gentle, touch the top of the rubber, and then gently increase pressure so it eventually slides in. Push the air in, flip your bottle upside down, and you saw that some of the fluid was already starting to go in. Now, using my other hand, gently begin to pull. And you will see the fluid. I've already gone past the 10. Trying to put that into focus for you guys right there. There it is right there. There you go. Boom. Okay. So then I pull it out and I have my, who would know brought this into focus is, there we go. You can see the 10. Okay. I like to put it in my mouth. All right. So you're going to clean this area up. Really get a really good job cleaning it up there. You're going to pinch this level of fat. 90 degrees to the skin. Okay, so whatever angle you're coming at, you want to come 90. You don't want to come anything outside of 90. 90 degrees into the skin. Just trying to get a better shot. And that was it, guys. Pop it in, push it in, pull it out. Couple more swabs just in case. If you bleed, it's not the end of the world. If you're bleeding every time, then your injection technique is not good. But you can work with Health Innovations KC. They'll help you out if you are struggling and you need some physical training, but it really is that easy, guys. Now we've gone over the keys and the fundamentals for your success regarding these medications. I'm super excited for you and your journey. Again, you're in great hands. James cares tremendously about your success, which is why he had me do this video for you guys. And so if there's any more questions at all after this video, please don't hesitate to reach Health Innovations and they'll take good care of you guys.